Mayo Clinic Health System has announced they will no longer offer clinic services at 6 different locations in rural Minnesota. KEYC News Now's Randall Gim met with other rural healthcare providers to get a better understanding of the announcement.
Mayo Clinic sent out a release on Monday night notifying patients their clinic locations in Belle Plaine, Caledonia, Montgomery, North Mankato, St. Peter, and Wells will no longer be in service after December 10th. Vice President of Mayo Clinic Health System said these decisions reflect the realities of providing care in rural communities, something Medelia Health President and CEO David Walls has a strong understanding of.
Healthcare, especially in rural communities, it's very difficult. You've got to know the operations inside and out.
Walls started his healthcare career in nursing, and he says keeping nurses and other staff is harder in rural areas. The same goes for Mayo.
I can speculate that there's some major hubs that they want to make sure that they're staffing appropriately and giving the care necessary to their larger facilities.
Another rural healthcare provider, River's Edge Hospital and Clinic in St. Peter, says although Mayo is closing, citizens of St. Peter still have options.
There's still primary care available in St. Peter, which is great to know.
But Walls says not every patient affected by these closures will be as lucky.
They're going to have to make a decision. Do they drive somewhere else or establish care outside of their primary care provider?
Republican State Senator Rich Draheim of Madison Lake reacted to the news saying, "I am frustrated, disappointed, and concerned about the direction we are heading. Rural Minnesotans deserve better than being asked to travel farther and farther for the care they should be able to find closer to home." For KEYC News Now, I'm Randall Gim.
MCHS reports that patients will be notified of the changes and the next steps. Additionally, they'll be offering one-on-one support for staff that are impacted by the closures.